I have Laura Williams with me today. And Laura, I want to talk about pelvic health consulting.
Thanks for having me. I'm really honored to be here.
Absolutely. So, Laura, I've heard about birth consulting, and some doulas will even introduce their work as being a birth consultant.
Mhm.
And they'll handle all of the things that we would think a consultant would handle, like a wedding planner, the preparation for delivery, the education. They'll even contact different friends and family members for meal train, help after the fact, cleaners that can do kind of the laborious tasks that moms really shouldn't have to worry about doing so that they can focus on their recovery. But pelvic health consulting seems like a new term. How do you define it?
Yeah. So it is kind of a new concept. And I think I'm still working it out, if I'm being honest. So it's a divergence from what I've been doing, which is working as a clinician, as a doctor of physical therapy, and a women's health specialist. Um, but I think that what it really means is I'm here to be sort of a healthcare intermediary in a way. So taking a step back, I think there's just this enormous gap for people after delivery between kind of discharge to home from the hospital, or if you have a home birth, your midwife leaving, whatever that distance is from actually delivering a child to seeing your midwife. I know midwives are more hands-on throughout, but in a more tertiary or clinical setting, like leaving the hospital to 6 weeks later seeing your physician, it's just a long time, and there's a lot of unanswered questions, and all of the attention is on the infant. And I think a lot of the resources that are available, postpartum doulas, birth consultants like you're talking about, CLCs, there's still a lot of focus on the infant, right? Is the infant peeing, pooping, eating? And there's very little support for actually nourishing the woman, right? Or the birth giving person. Are they eating, pooping, sleeping, being nourished, right? So I feel like it's too long. There's too much time between birth and actually having that consultation or that connection to a physical healthcare worker. And as a pelvic health consultant, I want to be available virtually from home, wherever people are, kind of meet them where they are to answer those questions sooner about their own intrinsic healing.
Yeah. Do you feel like your background as, you know, being a clinician, you saw too much waiting, which, led you to kind of like, add to your services, this intermediary service that you provide.
Absolutely.
What did you see in your practice?
Yeah. So just a little bit of background about me. So I moved to Salida, Colorado specifically because I was always sort of on a women's health track in PT school. I knew that was a passion of mine. I had really good mentorship, really great rotations early on. My background was as a professional dancer, so it was a really kind of natural transition for me, working on this kind of more subtle body element of physical therapy. And then I was just really lucky to connect with Anne Krogan early on in PT school. And I really wanted to be here specifically to work with her because she started this phenomenal obstetrics program where we do see women across 4 trimesters, and we have really specific hands-on support for them. So I'm in an environment where I see really good support and like really high quality support in the clinical setting, right? We do prenatal care throughout. We do labor and delivery training that really focuses on the biomechanics of birth and sort of optimizing chances of vaginal delivery, decreases risk and mitigates risk of unnecessary injury and intervention. And then we do have an immediate automated acute care postpartum visit in the hospital. And then we see everybody at 6 weeks, if not sooner, if need be. So we do have this like really beautiful through line for people that deliver here, but we're not a tertiary hospital. We are a hospital that delivers, we're a rural hospital. We're a hospital that delivers 100 babies a year, not 100 babies a month. And so we have this different construct that allows that kind of access. We also, our team specifically are very hands-on and very vocal with our clients that like, we're here for you. So we don't want you to wait for 6 weeks. If you need us sooner, like that limitation of nothing in the vagina for 6 weeks is really limiting, and that there's so much more to our scope than that. We may never do an internal exam if it's not indicated. So we make ourselves really available. But I have friends all over the country. I recognize that we're also a primarily white community. We are a well-resourced community. And that is just not the case nationwide. And so in places where women across the socioeconomic spectrum are having babies in these really massive hospitals, they're typically discharged much more quickly, not provided any information about their own healing when they're discharged. And a lot of time passes before they see their doctor, at which point they may or may not even be screened for pelvic health dysfunction. I think at best, most docs are really great about screening for postpartum depression, but less so sort of the subtlety of our own healing and the things that really impact our quality of life. And so if they're lucky enough to even know that pelvic health PT exists, right, like is a resource for them, they're often waiting another like 6 at best to 18 weeks to get in to see someone. So then your whole, acute postpartum time is over. And you've missed this really critical opportunity to interface with people where we can be screening for so many important things in those early weeks, and offering so much support to diminish the amount of discomfort and suffering that happens.
Laura, I want to validate what you said, and it's affected me personally. Just 2 weeks ago, my grandniece, if you can believe that I'm a great aunt, was born, and I was begging my niece to have a physical therapy visit while she was in the hospital. I knew that she had a flight of stairs that she had to go home to.
Mm-hmm.
She didn't have a lot of support. My nephew had to go right back to work, and I get a call 4 a.m. in the morning the next day that she nearly toppled the crib with the newborn in it because she was trying to grasp onto something that could help her get out of bed. She had had a C-section. And with my work in the hospital of fighting for automatic orders, just like Anne Krogan did with hers, I was working in the hospital at that time that saw 500 births a month, not 100 births a
Right,
year.
a year.
But I was still so inspired by Anne Krogan's work that I said, if it can be done in Salida, Colorado, wherever that gem of, a place is in this country, maybe we can do it in Houston, Texas. And we were successful after 6 months of just begging the doctors, please see these women as, all across the spectrum. Not all of them have support. Not all of them have, this robust care system, especially during COVID, where everyone's keeping a distance. Please give them at least that automatic visit that you're talking about in the hospital, and give them at least, support and instructions on getting in and out of the bed. And here, I am now 2 weeks later talking to you after my own niece could not get those services in her hospital in New Jersey, another part of the country, that really lacks that kind of preventative care model that you're talking about. So to me, a need for pelvic health consulting, we are way overdue for it. Our pelvic health therapists, we're really burning out. We get an order, maybe if we're lucky at the 6 week mark, but we have long wait lists around the country. When I was an outpatient pelvic health specialist, Laura, I had a 35-day wait list.
Mm-hmm.
I mean, that's like, how am I going to see someone in their acute phase? So pelvic health consulting, I know like it's this new term is evolving, but for people who just like really want to know the specifics of what you would cover between their hospital stay after they gave birth, and maybe that 6 weeks where their OB is saying, okay, now you can see a pelvic health therapist. What is a pelvic health consultant doing during that time?
Yeah. And thanks for sharing that. I mean, that just speaks, that's the story, right? That's the story that I hear again and again and again and again. And that really drove me to this place. From the clinician perspective and the patient perspective. The other thing that I think is a really big barrier, and then I'll speak to your question, is physically getting to the appointment. right? So they wait 35 days, they get in to see you, and then who's watching the baby, right? And my mantra is always, I'd rather have you here with a crying baby than not have you here. Bring the baby. You can nurse while I work on you. We can do patient education while the baby is crying, right? There's lots of women in this clinic that want to hold your baby. Come, right? But in other parts of the country, like transportation is an issue, child support is an issue, scheduling is an issue, jobs are an issue. Lots of women have to go back to work at 2 weeks or sooner. And they don't have this sort of luxury of being able to come to an outpatient clinic at a regular basis. And so we lose people through that. So the question that you posed of like, what is pelvic health consulting versus what am I doing as a clinician, has been really the root of kind of the work I've been doing throughout this whole year of trying to answer that question and figure that out. Because, being a clinician, like I really want to honor what is within my scope of practice. When am I acting as a DPT under my license? And when do I feel like I'm working as a consultant, and what falls under those two umbrellas? So how can I stay protected? How can I also honor the professionalism of our profession, right? And the immense scope of what we do. And how do I keep my patients protected? Like, how do I keep their privacy protected? So I started this whole process by hiring a lawyer and working with a lawyer to figure out, how do I do this? Like, what is this beast that I'm trying to finagle and consider? And how do I do it safely, protecting myself and my patient's privacy? And we essentially determined that if I did this as a doctor of physical therapy, the biggest barrier for me was that I was limited to the state, right? I'm not licensed outside of the state of Colorado. And the hill I wanted to die on was having national reach. Because like where I am is not where, I mean, I'm sure I'll have local clients. I'd love to have local clients, but my real mission is to expand to the people that don't have the kind of access we have in this community. So national reach was huge. And that right there automatically meant not working under my license. And so I'm not acting as a healthcare provider. I'm here to support healthcare providers. I'm here to help people understand what healthcare providers are available to them and how to access them and how to take care of themselves in the interim. So there are things, much like I think what we're giving in that sort of initial acute care visit, that I think are a fundamental right for people to know about their bodies after they deliver a baby, and things that I feel like I can, in good faith, give the majority of people in an individualized way that will not hurt them, like that will not harm them, but that will help them. So I think people deserve to understand how to breathe when they move, when they pick up their baby, to manage pressure well. I think people have a right to understand how to log roll to get out of bed. I think people can manage their scar tissue in those early weeks really safely without increasing the risk of infection. I think people can screen for red flags at home independently and know what is normal and what is outside of those sort of normal limits. And I think that I can do that without evaluating them, diagnosing them, treating them, right? So I'm not doing the things I would fully do in the clinic, but I think I can have a conversation with people and they can bring concerns to me that are I often say, like, it may not threaten your life, but it may not be life threatening, but it can still threaten your quality of life. Right. So I'm really concerned with those things that threaten the quality of life, and threaten a parent's ability to be present for parenting, connect with their baby, be involved with their community, reach out for help. Like, those are things that we've created a lot of shame and a lot of stigma around. People don't feel comfortable talking about them. They don't have a safe space to talk about them. And I just want to be that safe space to be like, yeah, this happens to a lot of people. It's not normal, but it is really common. You're not alone. And here's where you can start. And then I want to get people connected to products, resources, link them to resources and the providers in their area. So also help people kind of tease through this like overwhelming minefield of information that's on the internet, which is such a double-edged sword because we have great information available to us. But, as non-clinicians, people don't really know how to tease through that and know like what's good information, what's evidence-based information, what's up to date evidence-based information. And not only that, but like what's right for me now. There's plenty of great information, but it's not all relevant at every moment for everyone. And so just helping people understand, like, based on where you are now and the things you're experiencing now, here are the stepping stones to get to where you want to be. And I talk a lot about, like, after delivery, people often have really crystal clear goals, right? Recovery goals. They want to, like, be strong again and feel awesome in their clothes and enjoy intimacy again. But how to get there is clear as mud. And so to be able to, like, understand, okay, if I can self-identify that now my pelvic floor is engaging when I do A, then I can also recognize when I'm ready to maybe progress to that next activity that I'm thinking about trying, and know how to monitor if I'm ready for it. And those are all things that I do in my clinical practice, and I think are fundamentally the most important things I do in my clinical practice, but I think I can do them without the 18 weeks of waiting for someone to get in to see me. So I
Right.
just want to be more available to people.
And those 18 weeks, I mean, if we really look at how long, right, it takes for tissue to heal, to recover, and then to mature, to mature almost to a state where it actually becomes harder to change the function of this area when it's matured to a point of scar tissue that might be incredibly painful when we try to use it, when we try to return to sexual activity or to running or to jumping or to biking and being on in the saddle for long periods of time. And so my history of working with lots of athletes, it just made me realize the sheer irrationality, if you will, of waiting 18 weeks to heal their tissue after delivery versus, if they had seen me for, a hip injury. I would never wait that long, to
No.
start incorporating, those interventions. And so I needed to find myself differently the way that you did. And I'm so happy that you started out speaking about, getting a lawyer. Because to be honest with you, doulas encounter this all the time. They're not medical professionals, but they're constantly guiding people with information they have a right to know to that medical provider that they should see, or to even take their own blood pressure or heart rate at home. A doula is not going to assess that. They're going to encourage someone, please monitor your vital signs. If you're getting short of breath, if you're having any, issues, if anything seems out of the norm, here's a provider that you have to see. So to me, a consultant is the missing link that we have to really empower people with information they need to heal. That's what you're describing
Yeah.
is informed healthcare.
Yeah. Empowerment, information. I think even at that, just going back to what you said about scar tissue, like, even at that 18-week mark, there's so much we can do. I mean, we still can make immense changes on tissue quality. But by that point, there's probably an excess of scar tissue that's been laid that didn't necessarily have to, had we intervened sooner. And it's that lack of information that leads to just more work in the long run, or like a longer healing process. But I'm also very vocal about the fact that you're always postpartum and there's always change to be made, right? Like, you don't have to live with these things. And so it's never too late. It's just that it can be even better. We can just create a more supportive postpartum experience for people if we really utilize all our resources. And I do think that people are unbelievably resilient. I mean, the experience that I had in my own labor and delivery, which was going into it with all the information and all the knowledge and all the resource, and having this, like, super healthy, pregnancy where I was doing my yoga practice every day and my handstand practice till I was 39 weeks. And then I had a doula. I had an amazing team of doctors, and I was in the family birth center at our hospital, which is essentially like as close to a home birth as you can have in a hospital. And I labored forever. And I had a super funky labor pattern. And I had labor dystocia and didn't dilate, and ended up having an epidural and the entire intervention cascade, and pushed for 10 hours in every position under the sun, and then had an emergency cesarean. And right. And so I write about this and I talk about this a lot, that like that experience to me doesn't feel traumatic because I was involved in every step of the process and I had information. So I went in knowing what all the choices that would be given to me might be. I said no to certain things that didn't feel right to me. And I knew when it was time for proper intervention. And I trusted my doula and I trusted my doctor, and I trusted my intuition, you know? And so I had a lot of grief around that. And I had to really process that and dive into that and learn to accept it and learn to let it be an asset to my healing practice, not a deterrent, right? I was like, how am I going to go back to being a professional who teaches about physiological birth when I couldn't live it? But now it's taught me like it doesn't matter those things are out of our control. What are within our control are how prepared we are, how supported we feel, how included we are in the process, and that we're incredibly resilient. But the key that unlocks that resilience is knowledge. So when we're educated and we're given the opportunity to try lots of things, right? To make physiological choices, to try to spin our babies, to try to use gravity and positioning and breath and pain modulation and partner support to access the birth that we want to have, right? Then when things go differently, we're able to pivot because we've prepared for those potentials. And then having a team of people coming in and saying, we see you, you will heal, you can heal, and here are the steps you can take to take your power back. You know, people come out on the other side of that like so much more at peace and so much more connected to themselves and connected to their children and their partners. When I see birth-related trauma, it's coming from that place of like, all these things happened to me. People put their hands on me in a specific way. Consent was not received. And now I'm having to unpack that. And I'm left with this perineal trauma or this massive cesarean scar or all this incontinence or, you know, constipation, or the list goes on. And no one talked to me about how to manage that.
Laura, would you say that consent is a mix of like understanding what's about to happen to you, from what, was explained to you, but then like really just understanding the information that's being like, it's not simply yes to this, yes to X. Yes, you can press on my abdomen after I had a C-section to make sure that I'm not bleeding, internally. Yes, you can, check me to make sure that I'm dilating, or yes to, certain interventions, like breaking my water or starting the induction process. Consent to me is a double-edged sword because we might say yes to those things, but we really don't understand if they're going to be painful. We don't really understand if they might have adverse, side effects. So is it truly consent if it's uninformed?
Mm. Yeah, I think the answer to that lies in like the need for more education at different phases, right?
Mhm.
So no, I mean, if you just say yes because you trust your doctor and implicitly and don't ask questions and you don't know what you're saying yes to, then yes, you've given verbal consent, but no, you don't have a clear understanding of all the implications of that decision, right?
Right. And in your
Um,
experience, I wanted to ask you, like, did you feel like because you are a doctor of physical therapy, because you had informed yourself of having a doula and then having support, that even though, you might not have wanted to have a cesarean birth, that because you were in charge every step of the way, do you feel like your recovery, was that much more optimized because you had at least the information you needed to heal?
yeah, I do. I mean, I do. I think part of it was knowing, like, you know, having deeply studied all of the potential interventions and their purposes. And when I do labor and delivery training, um, I always preface with, you know, everything we're going to talk about today falls under the assumption that you and your baby are safe and stable. Because there is a time for intervention. We're lucky to have modern medicine, right? I might not be alive without it. So there's a time and place for intervention that may lead to sequela that are better than the alternative, right? I'd rather have this cesarean scar than not have my baby. Um, so there are risks and benefits to everything, but I think that knowing, having my doula say to me when it was time to get an epidural, this is not a normal labor pattern. This is not progressing. It had been 7 hours. This is when medicine is a gift. I mean, those were the words she said to me. And this was someone who had been in one other cesarean delivery in her whole career. So just hearing those words was really helpful. And I think then knowing, I said no to a vacuum. That was something that I really did not want at all costs. And I'm glad I made that decision. I got to do all my spinning babies. I got to labor in every position I knew. I got to use every technique I knew. And so when it did come down to having a cesarean, I at least felt like I had done everything I could. I felt like I understood how we came to that end. And so even though I still had a long recovery, and I had to work really, really hard to get to a place where I could be physically active again. And physical activity is such a part of my identity. I experienced a lot of postpartum anxiety and a lot of dissociation, and it took a long time to come home to my body. But I think I was able to really get there and then really flourish because of what you just said, because I felt like I had, through the hormone storm, I was able to come back to some clarity eventually and go, oh yeah, that was the right path. And everyone around me was doing their best to see a healthy outcome.
Thank you so much for sharing that. Really, Laura, just your whole story. I honestly, I feel goosebumps with just knowing that there are women who are suffering unnecessarily, because of the lack of information, the lack of understanding. They're being told, nothing in the vagina for 6 weeks, but they're not being told how to heal, whether, it's trauma mentally, whether it's trauma physically, whether, I've heard terms used, like my baby was ripped out of me. I mean, when a woman says that, there's so much unpacking, with that description of how she perceived her birth to be.
Yep.
And someone to just be there. We know that our OBGYNs are, quite possibly some of the most, busiest physicians that we have in the country. And they're not really able, to kind of explain every step of every delivery that they do. And so because of that lack of information or that support, that a person might need during those first few weeks or even days, they can perceive quite a different experience, and they need someone to talk to and kind of make sense of it and put the power back in themselves to control now their healing. And so the service that you're providing, especially with the story, your background, is undeniably needed. And I am curious now as one, how do people find you? How do people even find, I guess, the terminology around what they need? Because they still are now just understanding pelvic health therapy. They know what a doula is. They know maybe what a postpartum doula does. But to be fair, I mean, I had my family ask a few weeks ago, well, what's the difference between a doula and midwife? So we also have that kind of level of understanding. How do you make it so that people can know who you are, what you do, and then how to access you earlier rather than later?
Well, this, right? I mean, just talking, using my voice. I think this really was born of, it was born of such a confluence of things that were happening. I had so many people coming to me and asking me these kinds of questions like, hey, I'm having immense clitoral pain every time I sit down on the toilet. What's that about? Or is my vagina falling out? These are the kinds of questions I answer over coffee on Saturday mornings with my friends. But these are people who, a lot of them are RPTs, and don't have this information and don't know where to start. And honestly, when it's happening to your own body, no matter how much clinical information you have, you just think you're dying, like no matter what's happening, right? I mean, that happens to me too. I have round ligament pain and I'm like, oh, it must be, the end of the world. So I realized like if these are the people that have a pelvic PT in their back pocket and they don't have this information, then there's just a much bigger, wider issue here. So I think the biggest thing is literally just talking about it, just making this, being available, having these conversations with brilliant practitioners like you who are dedicated to creating a wider network of practitioners, a diverse network of practitioners, both professionally, racially, socioeconomically, in lots of parts of the country, so that we can kind of disseminate this information and this understanding. And I think doing it in a way that is non-threatening to other types of healthcare workers is the key. Because I am not here to bash anybody's profession. Like, I think everyone is doing their best, and I think everyone has a really important scope. But I think we need to figure out how to get people where they need to go and to know that these resources exist, right? So when I talk to the physicians in my hospital about it, they're like on board. They're so pumped because they know that my job is to make sure that people understand the value of going to that 6-week visit, understand the value of being consistent about their healthcare throughout their postpartum healing, and that they get to pelvic PT, or that they get to a mental health therapist, or that they get to a support group or a lactation counselor, So my job is to like uplift other professions, to enhance other professions, to diminish attrition, not to step on any toes, right? Or get in the way. Like, I'm a referral generator. So physically, where you can find me, my website is www.yourhearthhealing.com. And that website has an abundance of information. It's really easy to navigate. And there's a book now button, and you can just look at my template and schedule with me. I'm doing all of my consultation virtually, so you can literally be anywhere. If people can't find, right now I'm still working in an outpatient facility, so I'm only doing consultation 2 full days. If people can't find something that works because it's in the middle of the workday, like, I'm available. Like, I will talk to people at 6 a.m. or 8 o'clock at night. I don't care. Right now, my job is just to be out there and get people information. So, and I'm working completely through Simple Practice. So even though I'm not working under my license as a healthcare provider, I'm still working in a HIPAA compliant way.
Mm-hmm.
So all of our telehealth visits will be HIPAA compliant. Any healthcare information that's shared with me, which I'm only asking for really fundamental information. I don't want this like long, overwhelming medical history. I want this to feel like a really comfortable, like you're sitting in my living room with me, having coffee or wine, you're nursing, you're naked, I don't care, come as you are kind of experience. But I still really want to honor patient privacy.
I love
So,
that. Yeah.
so that's where I am. And I just want people, if physical therapists know that someone's not going to be able to come in and see them for 8 weeks, and they don't have the time to make a phone call and say, like, here's what you can be doing in the meantime, that's when they send them to me. If women are sitting at home and they're 6 months out postpartum and they don't even know where to start, that's when they come to me, and anything in between.
Excellent. Do you feel that the future of pelvic health consulting will eventually, span out to, say, even women who have an unexpected hysterectomy or a planned hysterectomy or other pelvic surgery, and who also just like are just like in this waiting period of, am I healing correctly? Is this supposed to feel this way? Why do I feel so alone? My family thinks everything's fine because they can't really see, what
Yes.
I'm going through. Do you see that pelvic health consulting will really expand to include, all of these populations who have probably more or less felt the same thing as postpartum women do?
Yes, I hope so. Um, Absolutely. I mean, we should treat abdominal surgery like any other surgery. We
Mhm.
would never do an ACL repair and not immediately send someone to PT within 3 days. So why are we doing cesareans? Why are we doing hysterectomies? Why are we doing, hernia repairs
Right.
and not sending people? Why are we doing scopes for, endometriosis and not sending people to PT to manage that scar tissue? So There's so much that people can be doing at home. There's so much information that's easy to disseminate that's just not hitting, where it needs to. And absolutely. I mean, my first, the vision I have for hearth healing is to eventually enter into 4 trimesters, right? So to be available for pregnancy consultation, to be able to do some labor and delivery education, which will address this piece that I think, circling back to consent, really encouraging people to just do their research,
Mhm.
to understand all of the things that might be offered to them and how to navigate in the moment, right? And also make sure that birth partners also understand those choices, so that if the birthing parent cannot consent, that the birth partner knows what their choices would be. They're A, B, and C, right? So that when those choices do arise, they can consent. They can knowingly consent. And I encourage people to pause, right? A lot of times in birth, it's like, we've got to do this right now. And it's like, well, what does right now mean? Does right now mean 5 minutes? Or does right now mean 2 hours because you have to gather an OR team? What is the urgency of this moment? Can we have space? Can we have a minute to discuss, right? Can we have the room to ourselves? Do you need to cath me like right this minute, or could you cath me in 5 minutes? And so in my dream scenario, I would be able to do that to prepare people for birth, so that then when we do a postpartum consultation, we're certainly unpacking whatever did happen. But I think we'll find that a lot of that sort of shock and disillusionment about what the process was really like will be dampened, because people just go in more informed about what really
Absolutely.
happens.
Wow.
And then be available, for like an early postpartum consult, and maybe more like around a 5th trimester consult where we're doing like return to sport or return to work and those kinds of things.
Right. I honestly, I feel like what you're doing is brilliant. It's so needed. It's going to transform mental health in a way. Uh, I mean, it's so fundamental to that. I mean, my mental health, my identity is so tied with activities that I do. And so the longer I'm away from those activities, and obviously it's going to affect me mentally. So knowing there's someone like you wherever I am around the country, because your license now is not a hindrance, you're able to speak and consult with anyone in all 50 states. And that's exciting. That's really exciting for people to have that option. So your information is going to be included in this talk. And I can't thank you enough for joining me today and sharing.
Thank you so much for the opportunity to talk about it. Thanks for believing in me and what I'm doing, and what you're doing is so profound and important. And I'm just totally grateful to be a part of it. And I'm here if anyone, ever needs me or wants to chat more. And let me know how I can support the Pelvic Health Network too.
Excellent. Thank you, Laura.